Maricopa County provides a whole range of human services. The whole lifespan is covered in terms of the populations that we address. And our employees in the county have been impacted like employees throughout the state. Yet Human Services is open and we are doing business. We're providing the needed services family need and are preparing for what happens as the economy begins to reopen. So what I wanted to do this afternoon is give you just a brief glimpse at some of the services we provide and how they've been impacted. Our Head Start program for young children and their families. Schools are closed, Head Start classrooms are closed, yet we're staying in contact with all the families, contacting them regularly, making sure that children are still learning and delivering food boxes when we can. Some of the employees at Head Start are helping with some of our other human services programs now. There's a lot of talk about the economic impact of the pandemic on employers and on employees, particularly some sectors such as hospitality. The stay-at-home order has affected the number of people coming into our workforce centers. We have 2 in the county, 1 in Gilbert and 1 in Glendale. Yet we're still seeing about 400 people a week, and these people are coming into offices to sign up for unemployment insurance. The Department of Economic Security is co-located with us, our offices, and also for help in finding jobs in this very difficult environment. Unemployment insurance is creating some traffic that we're seeing. Others are doing lab search, and through our workforce program now we are offering online virtual work with a career guidance specialist, and also we have virtual job fairs where employers are able to meet with people electronically and conduct an interview and be able to get a lead on a job. We operate crisis community services, so for years and years we have been providing utility assistance and rent assistance. We've done this historically. There's always been a greater demand than we had resources for. We're never able to meet the need. In fact, we stretch out over the year so some people can get every month. Now there's never been more demand, obviously. People are out of work, they need help with their utilities, and they need help with their rent. So we're operating some eviction prevention programs that are designed to help people stay in their homes so they can get back to work and be part of the economy. The number of applications we've got for all of our programs has gone through the roof. We're doing the best possible job we could do to respond to that demand. Like I mentioned earlier, shifting people from other sections of the department, but we'd appreciate your understanding. We absolutely will process all applications as quickly as we can. Finally, the work that we do with seniors under a contract with the Area Agency on Aging, we assess seniors' needs. We typically go into their homes and do assessments. We authorize services such as Meals on Wheels, or personal care. Obviously now, the vulnerable population, seniors and adults with disabilities, we're not making home visits in 90% of the cases. We're doing reassurance calls with those families to make sure they're getting the services. And you've heard from both Marcy and Angie just how important nutrition is to all populations. So we're continuing our work with community partners and preparing for the immediate future when things begin to open up more.